Welcome, 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 people. My name is Armando from Fire Rescue Group and Bomberos on Fire podcast. I got the pleasure today with somebody from the other side of the world, literally. But before we start the podcast, I want to say thank you to everybody who listened to me from the United States, from Europe, South America, and please subscribe to the channel. It could be in YouTube, Spotify, Apple, you name it. We are somewhere in one of the stream services. I got the pleasure today and I got the honor to be with somebody who's, we have a lot of things in common, even though we're different countries and we speak completely different cultures and languages. Mm-hmm. I got Cristin here from Germany. Hi. From Germany. And Cristin, please introduce yourself, who you are, what do you do, and we can start from there. Thank you so much, Cristin, for your time. And everybody listen.
Hi, my name is Cristin. I'm a German paramedic and working in EMS in Germany, but my main job is not working as a paramedic at the moment. My main job is working as a teacher for paramedic students. So I'm 31 years old and I studied, I'm not only becoming a paramedic. Before I also studied health psychology and medical education. So with these I could be a teacher here, and this is my job. So working in EMS and being a teacher for other paramedic students.
Which is great. I do the same thing, but in the States, in Spanish and English sometimes. Teaching is, to me, is more important than anything else in the world because you are helping the new generations to grow and don't make the same mistakes that we did in the past, working in the field.
Yeah, exactly. Yeah, this is a big part of my job, and this is the most part I love of my job, just educate people and inspire them, and just, I like the comparison to a flame. I want to burn them and bring them with a heart to this job and to, everything I love and everything I love about the job, I want to, bring to them, so it's
that's awesome. That's awesome because our essence as a medical provider could be paramedics, could be physicians, nurses, is to take care of people, regardless. So to me, being an instructor is like an extra step. It's a hard work, but it's also really awesome when you see somebody that you taught something, regardless of the skill level, doing the thing that you taught them in the right way, and that's amazing. That's amazing. That's no money, no salary in the world can tell me, hey, this is one of the great things to see somebody doing something good that you taught them. That's like kind of like extension of yourself, if you think about it.
Yeah, of course it is. Yeah.
So sorry.
Just ask.
I want to ask. I'm excited to ask a bunch of stuff for the German.
Start.
Yes. So I know we talked about it before. In Germany, what is your system? Because in the US, we have on pre-hospital side, paramedic, which is the highest level of care, and then you have the EMT. In the United States, you got the EMT basic, intermediate, and advanced, and then paramedic, which is the most advanced medical provider in the field. How's in Germany?
So it's nearly the same. We got a step, it's called Rettungssanitäter. So it's nearly like the EMT at the US because it only needs, I think, 4 to 6 months to become an EMT, like our German version of an EMT. And this is the first step how you can get into EMS. And we have real medical help. It's just for bringing patients from the doctor to the home back or something like this. It's not for really pre-hospital care.
Okay.
So it's more like a down level, I would say, like this. And then we have the EMT, and after the EMT we have the paramedic, and it's an education which needs 3 years in Germany. It's only a job which we have for 10 years. Before this 3-year education, we had another job. It was Rettungsassistent, so like an assistant for the doctor. It was another level, and it only got 2 years of education. So 1 year in school and 1 year like a practical year. But they canceled this way of becoming a paramedic, so a paramedic light, I'd like to say. And now we have this new education, like 3 years, and you're a full paramedic. and then you can go out and rescue some people. Yeah.
So this system has been only for 10 years, like the way that you are teaching, that you are paramedic in Germany.
Yes. So this way of education, so the Notfallsanitäter, this is the German called version of the US paramedic. It's nearly, I think, the same. And this job we got for 10 years. And before we have that, we had another level of education because we have a doctor system in Germany. So I think this is the most difference to the US. You do not have doctors outside. We use doctors. So
we use doctors, but we have medical protocol. So that means that they give me a book. That's I would say my Bible. I have to follow the protocol. Yeah. Protocol is my guidelines most because I can call my doctor on the radio and say, hey, doc, I know that we don't have this medication, or I cannot give, for example, somebody with a foreign object on the throat, to relax the esophagus, we can use glucagon. That actually help with the tissue to make it relax, and the guy can get away with the foreign object on the throat. We don't have that where I work, but we call the doctor on the radio.
Yeah, we started this 10 years ago. So so before this time, we had a system where the doctor assistants are only allowed to do the most specific parts and basic parts on the patient, and now we have a more specified job and a more specified, like we have a Bible too, like our SOPs, like algorithms, which which allow us to give medications, to do several things on the patient, like giving an IV or something like this. And this is much more the students have to learn. So that's why they decided just to put the education from 2 years to 3 years. And with very different, we have to go to the hospital during the education. We have to go to the paramedic station, to the EMS station, and just learn things in practical, but in theory as well. So it's a huge step we made, and I'm very thankful and happy that we made this step. And hopefully next time we will get to that this will become a study. But we're not sure yet how the politics will decide.
Well, politics is it's another subject and another podcast, literally. But away from politics, all we can do is take care of the people with the tools that they gave us. That's all we can do. And the same with mental health and behavioral stuff. All we can do is whatever we have on hands. So I got a question because that's interesting. When I went to Europe last year, I know that sometimes you have a physician and a paramedic on the ambulance, or we call it rescue in Florida. But do you guys have the same system, or you guys have two paramedics in one ambulance?
So we have on one ambulance just a paramedic and an EMT, and we have the doctor cars. I'd like to say doctor cars, where we have a physician and a paramedic on the car. And most of the emergencies were worked off from the paramedic and the EMT, so from the normal ambulance car, but the doctor has to get there. So the physician, it's a very tough word for me, sorry.
How do you say in German?
It's a doctor. It's just
you say doctor?
An Arzt, a doctor. Yeah, it's a doctor.
Okay.
So an emergency doctor.
You can say in German. It's fine. There you go. You can say in German. And trust me. Yeah, that's fine.
So we will call them when it's a tough situation, like a resuscitation or something like this. And but in my city where I'm working as a paramedic, we have a special system. So we don't call the physician that often. We have a telephysician here. So when I'm with the ambulance at my patient and my patient get worse or something happen, I can call the telephysician and can ask, what can I do? I did everything my SOPs allow me. What can I do in addition until the physician is onto the patient? Or maybe I don't need a physician in physical there when the doctor on call answered my questions. So sometimes I use it for the ECG when I have one and I'm not sure, is it something or is it nothing? And so sometimes you have patients where it's really very difficult to figure it out. And when I'm not sure, is it something or is it nothing? I can call the teledoctor and can ask, hey, do you see something? Do we have to go to cardio, or is it just a normal intern patient, or what do you think? So it's very very, very good system.
It's
We are,
interesting.
yeah. Here in Aachen, we were the first city in Germany who had this system. And yeah.
Wow. It is that system is standardized in all Germany, or it's just your city to start doing that?
No, it's just only our city to start this. At the moment, it's getting more and more. So more cities join those systems. Not only our system, there are, I think, 3 different systems, but they mainly do the same. And and more they learn, hey, a physical doctor, a physical physician is very expensive.
Yes.
Yeah. It's very expensive, so maybe we can do it with an on-call doctor, and it's not that expensive, but the questions we ask to them are exactly the same, so when the doctor is right through the emergency. So that's why, we have these both systems, and our politics in my area decided that this will get in the next 10 years for all over the nearly area I have around me. So
nice.
Yeah,
that's actually I can see that working here. The teledoc on the ambulance. That's actually a good system. Your SOPs are standard for everybody in Germany, or depends of the region or the city or the county. I don't know how you guys.
Yeah, it depends on the city.
A big smile is like, not the same.
It depends. It totally depends on the city. So in my area, we have very good standards and very high standards, very high levels. So you can do much, much more with the patient, like in middle of Germany. So I worked 7 years ago in the middle of Germany, and I wasn't allowed to do that much things or to give that much medication I'm allowed now. And this is a huge difference between all areas or regions. Where are you driving? How different the patients got their medication. I think this is a huge ethical problem, because in my opinion, every patient should get treated the same way and with the same standards. And we do not have this yet in Germany. We are working on this, but we do not have this at the moment because, so the chief doctor, the chief physician of the area, of the region is in the part and has to decide what he is allowing to his paramedics. And when he is a doctor, like, oh, the doctor are the gods and the physicians are the huge persons, you are not allowed to do that much as a paramedic. But we had a change in the laws the last years, so they are working on it. We had some changes. We are allowed to do more now by law without a doctor, but not that much in every region. It's kind of difficult to describe this.
Well, it is. It is not, because in the U.S., at least in Florida, we have a medical protocol, right? Written by a physician that controls a county or controls a specific area. So you can have 10,000, 20,000 medical protocol, different protocols, depending on the region where you are. So I understand where they're coming from, but we have a minimum standards that we have to require to have.
Yeah, we have as well.
Every protocol.
Yeah, we have minimum standards. Yeah.
Yes, perfect. So,
like resuscitation or something. This is everywhere the same. So, like adrenaline and amiodarone, we have to allow.
Yes.
We do it everywhere. But there is specific, like what you do with let me think. So in some areas you can do medication at a STEMI, and in some areas you cannot do something. And this is a little bit difficult, but we have a law now which allows us as a paramedic to do it all over Germany, but not at all. So it's very difficult to describe.
That's fine. But you know what? It's changing. It's changing. It's getting better.
Yes.
That's a good part. It's changing. So that's good. So, now we're talking about drugs. What drugs are you allowed to actually give? Because my protocol is kind of limited. We covered the basic stuff, like for STEMI, we give nitroglycerin, aspirin, oxygen. You know, the main stuff. Besides recognizing the MI on the EKG, we can actually transfer or send that EKG to the hospital or the cardiac unit that will wait for us. If we have somebody with a stroke, we have to go to a stroke designated hospital. I cannot go anywhere. The same with a trauma. If I got a big trauma, I go to a trauma center. I cannot go to the little ranky ER that's falling apart.
Yeah. Okay.
Do you guys have the same?
We have, we have to differentiate between trauma and other emergencies. So we have trauma centers as well. We have huge trauma center, especially in Aachen. We have one of the hugest trauma centers in whole Europe. So my hospital here in Aachen, RWTH, I don't know if you know this, RWTH, so Rheinisch-Technische Universität. It's kind of huge specific German word.
Yes, that's fine. And, you can say it. People love it.
Rheinisch-Westfälisch Technische Hochschule. It's kind of like this. I'm not sure about the term. And this is one of the hugest hospital all over Europe. There we have level 1 trauma centers. So, over all regions, hugest trauma center, neurosurgeons, everything you want to. And then we have local trauma centers and regional trauma centers. So local trauma centers are the least levels and regional trauma centers are the middle ones. And then we have the huge trauma centers, level 1s. And these are the trauma centers where you can drive everything in because they can do everything. They have a special thing. Then we have stroke units as well. We have cardios as well. So it's all over the hospitals.
It's similar to the US.
Nearly similar, I think.
Yeah, similar. So we have now, we had a new tendency. The hospitals are building small ERs. It's just an ER building with the minimum for working as an ER.
I think there is a lack. There was a lack of your internet.
Oh, there you go. There you go. Back again. Yeah, no problem. It is what it is. We're doing between two countries, so this is I'm used to it.
6 hours time difference.
6 hours. Yeah. So right now, guys, you listen to watching us right now in the US is 10:30 or 10:45. I don't know. In Germany is what 5 o'clock?
Nearly 5. Yeah.
Nearly 5. So be patient, guys. Whoever's watching us, because listening is no problem, but watching us is a big one. But yeah, we have now they have a new tendency. They're building a small ERs, just an ER, 10 beds, CAT scan, lab, and that's it. And whatever they cannot take care of, they send it to the middle, like you said, the middle, the second level hospital with beds and more units. This is interesting. It's almost the same. It's close enough that can relate the same in Germany and the US, which is good.
I got to know your system in Chicago last year when I visited Chicago and was talking to other paramedics. They, we talked about this hospital system and it's nearly the same, exactly nearly the same. So there is no huge difference to Germany.
The different now, and now do you have, because we have here, for example, 911 system, which is you call 911 and you go everywhere. I think you guys is what 112. 112. Yeah, I remember.
So we have 112 for paramedics and for firefighters, and we have 110 for police.
Oh,
so this is separated. Yeah, it's separate. 110 just for police things. They do not collaborate with us that much. Only if there is a police thing and a medical thing connected. But normally we have 112 where you can get all these firefighting and medical emergencies.
I didn't know that. Yeah. Also, it's 911 and it's catch it all. So whoever calls, they send a unit.
But in Germany, they opened up the 911 as well. So I can call 911 here as well, and I will land on my on-call guys same like when I call 112.
Okay. Yeah. Oh, wow.
They opened up the number worldwide. So
yes,
this is
that's awesome.
helpful.
And another thing, do you guys do, because we have like the 911 paramedics and you got the Intra facility paramedics. Those are the guys who transport one patient to another hospital for one hospital to another hospital. Let's say. Oh, yeah.
We have another number for this.
Okay. How do you guys call it? We call it Intra facility medics.
Yeah, we call it nearly the same, but it depends on which level is the patient. So is it like a patient from hospital to hospital? You do it over 911. Is it a patient like Grandma Smith has to come from home to a doctor station, or Granny has to come from hospital back home, this is a different part of our EMS system. So then we have like low levels EMTs who do this, and it's on another number. It's 19222. So it's very difficult.
You guys have too many numbers.
Yeah, we have, but it is not part of the emergency system.
Exactly,
nearly, but not that much.
Exactly, because we got the same. We got the guys outside 911 system.
Oh, we have
and
a
then
lag
you got
again.
It's fine. Intra facility. No, I can see you moving. Perfect. If I'm logging, if I got a glitch, hopefully I'm in a funny position.
Sometimes you have.
Yeah, hopefully I'm in a funny position so you can laugh a little bit. And then we have the inter-facility guys, and then we have the helicopter guys, the air care. Do you guys have that, I imagine?
Yeah, we have that too. And you can get them over 112 as well. So over the same, And it depends on...
And who's on that crew? Because we use a paramedic, a nurse, and a respiratory therapist. We don't have physicians in the helicopter.
So we have a pilot. And no, I have to differentiate as well. There are different types of helicopters. The normal one helicopter is a pilot, a HEMS. So this is a HEMS guy who is a paramedic and has a light pilot education. It's a physician. So these three are on our helicopters. And sometimes when we have helicopters, maybe in the mountains or down in Bavaria or something, where they have to rescue with the helicopters out of the mountains, they have a specific operator on the helicopter who's a paramedic too, and who's able to getting some persons up with the rope rescue.
Okay,
and that's why they don't have normally 4, but most helicopters in Germany have 3 persons: pilot, paramedic, like HEMS crew paramedic, and a physician. Yeah.
Wow. We use instead of using a physician, we use a nurse, and that nurse has extra degrees of. Actually, she's a nurse or he's a nurse and a paramedic license. So in order to work as a nurse in a helicopter or an ambulance, you have to be a paramedic too.
Wow.
And then take critical care transport unit classes and all that. So we also have assistants critical care transport. Those are like over level because use vents, for example, or TPA for strokes as to transport. They use our CCC truck, which is a nurse, a paramedic, and sometimes an RT or respiratory therapist in the truck.
We have that trucks as well. It depends on the region too.
It's the same.
Our system is so complicated. So in my area, we have a huge truck where you can do ECMO patients and everything.
Yes, the ECMO guys.
These are specific persons who can go on this truck. I am not allowed to, and I don't want to because it's not my thing.
ECMO is a different world. That's
so this is a huge truck where sometimes 20 people are in there. Like when you're staying in ER and watching this truck, like, oh, how many guys coming out there? Once again. So it's quite funny,
wow.
And we have other intensive care units like with ambulance cars in my city where I drove often on because we have some patients which have to go from intensive care unit to intensive care unit, but don't need an ECMO or something like this. So maybe they have breathing control or something like this, and then we drive them via these specific light intensive care ambulance car.
Okay.
Yeah. We have
it's still similar to what we do. Kind of. But,
I think so.
So as you know, I dedicate myself specified to 911 system. So I'm the guy outside going first on scene. And also I'm a fireman and I do technical rescue stuff, which is fun. But here in the US, at least more up north, you have the paramedic one side and the firefighter in another car. They don't mix. In Florida, we mix. I think it's for saving budget because you can pay at least money to a guy that can make 2 jobs. But how's in Germany? You guys also paramedics or not at all?
It depends on in which region you are. So it's
just like the US.
Fucking complicated. Yeah. So we have firefighter station here in Aachen as well. So it's like this is their main job to be a firefighter, but they are doing paramedic things as well. So they have both educations. But in some other regions, you normally are just a paramedic like me. I do not have any firefighter education. So I'm just only a paramedic, and it's totally okay. You can do this. Only huge cities have this doubled system. So I think cities with over 100,000 people, I think, have to have
Munich, for example, I meant Berlin.
Yes. Berlin, Cologne, Hamburg. And I think it's cities with over 100. I'm not sure about this, just a guess. But I think it was 100,000. If you have more people, then you have to have a fire station, like where you have both paramedics and and we have very, very often volunteered firefighters. So Germany just mainly uses volunteer firefighters. They do this all in their free time. Yeah.
They don't.
So that you get paid for being a firefighter. We have that very often, and the village is maybe 20 kilometers from the next city far away. Then you are normally a volunteer firefighter. So you go into a fire, you do the same thing like a firefighter who is paid for this, but you're a volunteer and you do not get paid for this.
But
it's just like a hobby.
You do it as a passion.
Yeah.
Yes. Yeah, we do have the same in the US. We have volunteers, we got pay firemen, we got volunteer EMS services sometimes. It could be for budget or, like you said, population numbers. You don't need to pay.
We have this for paramedics too. So on like concerts or some I don't know, festivals or something. Yeah, you're working as a paramedic for free.
Oh my God. No,
as
on the
a volunteer.
concert. No, I love my profession. I love to be a medic, but working in a concert as a paramedic for free, I'm out.
Oh, I do it very often. I would.
I'd rather be. I get paid.
It is a total good experience because one example, 3, 4, 5 years ago. Oh, 5 years ago. It's longer. There was Corona and everything. So 5 years ago, I was as a volunteer paramedic on the Ironman in Frankfurt.
Oh.
And it's, Ironman, like they swim and run.
The marathon, the ultra marathon stuff, swim.
Totally crazy people. And I was as a volunteer firefighter over there, and it was a very warm day. It was 38 degrees Celsius. I'm not sure what it is in Fahrenheit. It was very warm, very warm. And the runners, the sporting people fell down like leaves. So they were very, very, very tough and got illnesses and fever and dehydrated and everything. And this was a tough job on this day. It was one of my best experiences to work with stress. So I'd never had a day in EMS which was so stressful, where I have to get to see so many patients. And that's why this was a very, very good training for me, just to diagnose a patient within seconds. And as good as every patient I see in the morning, I have to do it in the evening. And this was very, very tough, but it was a very good experience. So that's why I often do this as a volunteer, because it's a good experience.
No, the experience was amazing, but you don't know what you get into. Like example, I work as a paramedic in Venezuela, in South America. So the experience that I bring when I came to the US is way more than somebody's whole career, because I was in Venezuela, capital city, when you get shooting, stabbing with no resources, and you have to figure out stuff on the fly. And when I came here, I have to like rethink a little bit the way I do stuff, because where I come from, Venezuela, is like a Wild West. I can do whatever I want.
Okay.
Literally. I can even suture on scene. Because I got a physician next to me.
Okay.
When I came to the US, I was the only one on scene. Especially when I work my first 6 to 7 years in the fire department called Orange County. It's a paramedic and an EMT. That's it. You the highest level of care. So it's up to you. You are the leader. You are in command of the medical scene. It's the same now where I work at the moment currently.
So this depends on, I need to Google a word. So this depends on the event. So in some event, the politics say you have to have a physician there because there are so many persons, or there's very vulnerable persons or something like this. And on other events, like sometimes we have maybe some like horse races or something. This is just little events or something, and there you don't have to have a doctor, a physician there, and then you're as a paramedic on your own as well. So it really depends on the event. We have very strict rules for the events, from which at how many persons do we have to have a physician there, and when we do not have to, and it depends on the event.
Okay. Yeah, I can see that.
If you are on your own or if you have a physician there.
Now, in the US, you have to work as a paramedic on the physician license. So even if the doctor is not on scene, you have to have a protocol. And if something happened, you call them on the phone, on the radio, hey, doc, I have this. What should I do now? So it's basically similar to your system in Germany. So let's say I want to move to Germany. If I go to your hometown, I will feel like I'm home because the change is not much besides the language and the culture.
We will see. I'm going to introduce you into the telephysician, and I'm going to show you my school, and then we will see if it is really the same.
I want to see that, especially now mentioning procedure-wise. So, in a specific now, why you guys can't do on scene? Like, am I able to do a crike?
Yeah.
I'm able to do.
Now I can hear you again.
Can you hear me now? Perfect. I'm able to do a crike. Yeah. I'm able to push, for example, Versed or fentanyl or. Well, it used to be dopamine, not anymore. We now all epi drips. I work, but I'm able to do a lot of things. I can do EJs. I can do. I can drill with a IO system for.
We
access.
have to. We can too.
But in our case, for example, when you go through school, paramedic school in the US, they teach you to be the leader. Like if we got a cardiac arrest, I'm not touching the patient. I am not. I'm stepping back. Yeah, I'm stepping back and I'm giving orders. Like, you do this, you do that. It's called the pit crew mentality. So you have a leader. You got a leader on the front, or it could be on the top of the head or by the feet.
Okay.
And that paramedic tell everybody what to do.
Wow, crazy. So
and you do communication back and forward. Yeah.
We do very, very intense crew resource management. We do this as well. But as the leader of the team, so we have a team leader and a team member, so the paramedic and the EMT. As a team leader, you just have to do all the decisions, but you are as well the one who has to do most of the invasive things, like giving the medication and everything.
IV access, stuff like that,
Yeah, we do not have a leader at the outside. When the physician is there, and when it's a good physician, he is the leader from the outside. When he's a bad physician, in my opinion, it's just my opinion. When he's bad, he takes everything over, and he's like, I don't need you. Just go away, guys. I'm the doctor, and I do everything. So it really depends on the doctor, but we are trying, and I think this is the thing which came from the US to Germany, like the crew resource management and everything, that we learned, they are doing something right. Maybe we have to look over the big ocean. And I think it's from the US more and more.
Awesome.
And like, when you see like AHA things, the cardiac arrest things and everything, these are mainly the same we do here in Germany. Like, we have the European Rescue Council. I don't know if you know them.
Yes, I've seen it. It's close enough to the AHA, BLS, ACLS.
They're working together. Yeah, they're working together.
It's basically the same.
They are bringing out our resuscitation algorithms every 5 years. So it's nearly the same standard. And last year when I was in Chicago, I compared both algorithm, and it's exactly the same. So you're doing exactly the same like we do. And it's not a surprise for me because the data is the same. The problems are the same. Yeah.
Yes.
So that's why I think this is very good that we will get more and more together and learning from each other. And that's why I'm so excited for this project, like to get a, I don't know, paramedic exchange or something like this. Very good
so
one.
For those who don't know, probably most of the people, except for you and me and somebody else called Ali. Ali, I want you in the podcast, by the way, if you listen to the podcast. Yes, we're trying to see if we can do exchange of knowledge of paramedic, and we can go there and you can come here at some point.
Mm-hmm.
But we need to plan with everything. But I think that would be a great idea because the pit crew concept come from AHA.
Yeah.
You get drilled with that in school. In paramedic school, here it's 1 year, but it's intense 1 year because everything everything that you know, imagine in 1 year. Plus, you got clinicals in the hospital, clinicals in the fire department and ambulances or private companies. I mean, it's intense. And like I said, that pit crew concept is something that is drilled in our head. So the way we do stuff, especially where I work, is like I said, if it's a cardiac arrest, I don't touch the patient. That's it.
Crazy.
I let everybody else do the work, and I bark the orders. So I do this, I do that, and if you know it happens when you end up in a public area, somebody say, "Oh, I'm a doctor. Oh, I'm a nurse." We got a system in our protocol that you're a doctor, you want to take over the scene. You have to sign a paper, and you have to call our doctor on the road and say if he's okay with you. If not, get away from the scene. Because
crazy!
I don't know who you are. I don't know your credentials. I don't trust you. I'm glad that you're here as a doctor, but get out of here.
We are trying to teach our students that everyone in the team is on the same level. They are not really on the education on the same level, but every team member has to have the same level of opinion. So if my EMT tells me, "Oh, I'm not sure if this is the right decision," I, as a paramedic, as the team leader, has to say, "Okay, let me rethink my decision." So every team member is allowed to to ask questions, to give tips, or to and this is a good thing of crew resource management, I think, so that you use the knowledge from all over the team, because I can have a bad day too. I can be tired. I can be hungry. Maybe I'm missing out something what my EMT is seeing. So that's why I'm very, very glad and friendly and polite, mainly, hopefully, to my EMTs, because sometimes maybe they're saving your ass, and this is very important.
We had a say that said a good paramedic is a great EMT. So
of course.
I'll take that. But now what I work is 2 medics, no EMTs. So you got 2 medics on the rescue. We call it rescue.
This can be good as well.
Because I got
this
2
could be good as well.
We
sometimes when there is a good personnel,
I think
when we have
we can do something
enough
with the
paramedics
stuff.
there, it happens that I'm working with another paramedic too, and these are very good shifts because you can switch at the patients. Now I am the leader, and the next patient he is the leader, and we can switch around. And this is such a nice experience and another way of working. But I really like this, just to see other paramedics work and how they are doing. Maybe the patient history or something like this. And it's very impressive sometimes when you see people with other behavior, like, okay, they're coming to the same result, but in another way of doing it. And I like this really.
It's awesome. EMS, even though we got data and everything is specific, there's too many ways to do something or to see something. So that's why a second set of eyes, could be a paramedic or could be an EMT, it helps a lot to get the whole picture of the scene. Because our main job is basically be a detective, if you think about it. Because we're looking for clues on the patient or even on the house. You go a house and you see needles on the floor. Oh, that guy's doing heroin. Or he's doing stuff with drugs. So it's like a detective job for me.
I like this. It's nearly like this. And sometimes I'm telling my students I am doing lessons like anamnesis, like how to ask a patient and what you know about the patient. And I'm introducing that you are a detective and you have to find out what is wrong with the patient. And you can do this with clues, with just looking, with smelling, with touching the patient. And I think this is a good comparison. I like this.
It's like a freaking Batman. We all Batmans in the boy. I got a question. You guys schedule is 24 hours, 12 hours? How do you guys work? All depends. Oh,
It
you go, that
depends
big
on
smile.
in which region you are.
I love that smile.
It really depends on. So basically, normally we have 12-hour shifts. In some areas we have 24 hours, mainly where the firefighters do the paramedic things. There are 24 hours. So in the big cities, normally. And when you are working on like German Red Cross as a paramedic, for example, then you have to do 12-hour shifts. We have some cities who were trying the 8-hour shift model. I don't know much about them, but most in common we have 12 or 24 hours.
Okay, perfect.
I did both, and I think both have pros and cons. So I'd like 24-hour model, but I also like 12-hour model. It both have pros and cons, I think.
Yeah, especially if you do 12 hours, but you do it overnight. That's when it gets you.
Yeah, but I think it depends really on where you do these shifts. 12 hours in a big city with 14 calls per shift can be totally exhausting and brutal. And on a 24-hour shift in a village where you have 3 calls per 24 hours, yeah, come on. This is not that exhausting. And it is. I think, in my opinion, it totally depends on where you do the shifts. You can have very tough 12 hours. You can have very tough 24 hours, but you can also have a very silent 12 or 24 hours. So it totally depends on where you're driving.
I agree. When I was working in the county, I was in an area as OBT, which is, I used to have 16 to 14 calls in 24 hours, a shift. Mm-hmm. And out of those would be at least 3 or 4 heroin overdose. Mm-hmm. And then trauma because the pimp hit the hooker, or it was rough. Now that I'm at the creek in the Disney area, it is nice. I could have 20 calls, but it's no toe pain, syncope because it's too hot in the park. Mm-hmm. Well, like last night, I told you, I got a guy, somebody who called because the ear headphone was stuck in the ear canal. That's a legit call. I had calls that I got a bunch of strokes and MIs in that area. I had one time working in the county, I had somebody who called for opening a wine bottle to the fire department or releasing a bra. Somebody called the fire department because the bra was too tight, and they called 911. I know.
Wow. Yeah. This is a problem we have here as well. So
you have it too. Okay.
Yeah, we have the same problem. Like a mom who's calling because this little girl have a little cough. And you were asking, okay, what about the cough? Yeah, it's from yesterday. Okay, do you try like inhaling something? Yeah. No. Does she has fever? No. Okay, why you're calling 112? Why you don't go to the pediatrics or something? Yeah, because I want to be sure that this is not whatever. We have the same problem, but I think we have a difference. We do not have that much drug addiction things here. We have this in huge cities. We have this, but on a countryside, no. When I moved to Aachen, it's 7 years ago, I moved to Aachen. And before I lived here in the city, I lived on the countryside and I was rescuing on the countryside. I never saw a drug overdose on the countryside when I was a paramedic until I moved to Aachen. My first drug overdose I saw here in Aachen in a huge city. So in Germany, we do not have the same problem with like fentanyl or something like you guys have, or what is this? Not codeine, like oxy. Yeah,
I think
you have
all the opioid crisis, and then we have the new alligator or crocodile drug. Make people into zombies. Came from Europe or Russia. I don't remember.
So we have these problems. We drive drug overdoses, but not that much like you guys in the US do. And I saw this in Chicago. I was astonished how much drug overdoses I saw in this few hours I was there, and I visited the guys there. So it was really crazy. Well, it's not the same amount, I think.
It is not. Hopefully, when you come to the US and you come to Florida, we can get you exchange paramedic, I don't know, and you can work in our area, which is Disney area. You'll see how different
I'd
it
like
is
to
be in the theme parks. on the theme parks,
like in the Disney park.
Yes, I cover
Whoa.
where I work. I cover that. So it's a complete different point of view. A lot of behavioral, a lot of anxiety, depression. That's a lot of that. I have a lot of refusals because imagine coming from Germany, right? Saving all that money to go to Disney. You're paying thousands of dollars and you get a fever and you call 911 and then you don't want to go to the hospital. You want to stay there because you pay for the resort, you pay for the park. So we have a lot of refusals. Of course, if that patient matched the boxes for refusal, perfect. Yeah. But most of the people don't want to go to the hospital because they're there to enjoy the vacation.
Yeah. So it's a different way of solving the problem, I think. You cannot only say, okay, we go to hospital and they will help you. It's, okay, you need to solve this right here, right now. So because I think this is a very kind of different.
A lot of resources that we use. We can use the Disney employees to help us. Hey, if somebody throw up, you have a towel, you have a t-shirt, and they bring you everything they need for the patient. Because it's customer. The place that I work is customer-based point of view. Like we make everything for the customer or the patient.
So
we're trying to make us comfortable.
Yeah.
Yes, we're trying to make it comfort for you, and we get it. You come from another country, you don't speak English or Spanish in my case, so I can help you out. You speak. I had a patient from Japan, no English at all. I have to use Google Translate on my phone to talk to them.
Yeah, and we often have this with Netherlands here because
it's Dutch.
Aachen is really close to the border of Netherlands. It's only 2 or 3 kilometers, so it's right.
It's right there.
And we have Belgium as well. So we have the 3-country point area here in Aachen.
Oh my God.
And we have Belgium, which French-speaking people. We have Dutch-speaking people. And sometimes, but I have to say the Dutch-speaking people mainly are able to speak German. But sometimes I had the situation that we rescued in Netherlands as well, because sometimes they call us from the Netherlands, hey, do you have an ambulance left? Because we do not have one. Can you send us an ambulance? So sometimes you're going to rescue in Belgium or in Netherlands. Yeah.
I got a question. That's international help, right? If you think about it, how do you okay, that's actually awesome. How do you go to another country using your own protocols? You have to have a special permission to go to Netherlands and help out that person? How that works?
I think this is like a contract they did. So Aachen is right on the border to Netherlands, and right next to the border of Netherlands there is a city called Vaals. And the next ambulance station from Vaals is in Maastricht, which is 30 minutes away. And sometimes, because Netherlands have a very different paramedic system, EMS system, it's completely different to the one of Germany. It's more like in the US, they have paramedics and they do not have that much physicians on the streets. And they have less people in the whole area than in Germany. So that's why they have less EMS stations. And that's why to the city of Vaals, it's 30 minutes to get there. But from Aachen, we are in Vaals into 1 or 2 minutes.
Yeah.
And that's why it happened that there is a resuscitation or something like this in Vaals, and they call us in Germany because they know we are faster.
You're closer.
And I think this, I think this is kind of like a contract they did to each other. So, or sometimes I remember when I was on the intensive care ambulance car, they asked because we have much more of the perfusers on our car. I don't know if you know what
Perfusion,
I mean.
IV pumps?
Yes, IV pumps.
We don't carry that.
You don't carry that? Okay.
No, that's a nurse job or physician. We don't carry, at least where I work. Some places, they have to have IV pumps because the distance of transporting is too long. Like it's over 30 minutes, but I have an ER. I have an ER, and where I work, 5 minutes literally.
Oh, there's a leg.
Yeah.
Hello.
There you go. So,
no, I can hear you again.
Yeah. So in my case, I have so many ERs around me and so close to each other that my distance to transport from the event to the hospital is 10 to 15 minutes at the most.
We have this as well, but we have IV pumps. We have the same situation, but we have them, I think, mainly for inter-hospital transports.
Okay, yes.
And on every ambulance car, we have one. On the intensive care ambulance cars here in Aachen, we have 5, because sometimes you have very special patients from intensive care to intensive care who had much more of them. So that's why we carry more. And that's why it happened when Maastricht called the Uniclinic in Aachen just to ask, hey, we need a car with more IV pumps. Can you borrow us a car and some guys from you? And it's like a contract they did. I don't know how this works. This is political thing. I think it's like a contract between all these three countries.
It's awesome. I can go to Netherlands if I work in your city. I can go to Netherlands, come back, patient. That's awesome.
Yeah, I can show you the Netherlands as well. Maastricht is one of the nicest city we have all around here. Cologne is very good. It's 50, 60 kilometers far away. Maastricht is 30 kilometers away. I can show you so many great things here.
Oh, you will. No, you will. Because when I go to Germany, me and Ali, we go over there. We will. Yes, we will watch all that, because
I think you will have a nice trip here.
Yes, I will. I will be really curious about how that works. We go to Netherlands and Germany, and that's awesome.
I will prepare the perfect tourist program for you guys, the perfect paramedic tourist program. So
I'll take it. Embrace it. And I know we almost an hour. See, I told you almost an hour.
Oh wow!
So I see when we have fun, time passes really fast. So talking about something else. I know we work 24 hours, 12-hour shift. We do 14 calls or 20 calls in 24 hours. How do you guys deal with mental health for your medics, for your EMTs? What do you guys do to relax and chill? Besides drinking beer?
I think this is beer is cheaper than therapy, isn't it?
Yes.
So it's a problem. I think we do much for this, but we do not do enough at the moment. Okay. So we try to teach our paramedics in education all about resilience and how to get rid of stress and how important it is to have hobbies, to have something like where you can forget all the things of work. We try to teach this during the education, but when they get onto the paramedic stations, when they got into work, normally the stations were not doing enough. So it's the thing with sports. When you are working on a firefighter station, you are able to do sports during the shift because they have a fitness center or fitness room or something like this. It is normal that they do here in Aachen. It is from 2 to 4. They have sports time. Every day during the shift, they're doing their sports, except they have a call, then they go out for the call, of course. But when they are not on call, when there is no emergency, they have time to do sports. For the paramedics on the EMS stations where you don't have a fitness room, you have a television, you have a couch, sometimes you have a kicker or a darts play, and there you can, have some free time with your coworkers, but there's not a thing to do sports. This is not very often. Some stations have this, but the most paramedic stations do not have a sports room or a gym or something like this. So the thing here in Germany, most companies do is that they pay $10 for the gym each month. So you can ask
membership.
So they do in addition to the membership if you want to go to a gym. So this is one thing they do. For mental health, I think we're doing two less things. We only have some persons specific educated when something went wrong. So these are specific and educated guys, like with crisis intervention or something, who you can call when it happened, when there was a bad emergency, when there was a huge, many persons or something, or when there was a kid's resuscitation or something like this. Then you can call these guys, but this is after it happens. We do not do enough before it happens, and this is a huge problem. I think we're still learning at this point in Germany. We're still trying to get new ideas for it, but as far as I know, and in my experiences, no, or it's only, I think, my experience, because I don't want to talk for all of the people in Germany.
Yeah.
So in my experience, the companies do not do enough before the trauma happens. And I think this is a huge problem. So we try to teach them, we try to prepare them, we try to how to deal with stress, how to deal with long-term stress, but it's not enough. Like when you are a paramedic, what do I do then? There is no teacher who is giving me some tips. There is no instructor who is helping me out in such situations. You have to, watch your coworkers and hope that your coworker is realizing that something went wrong with your mind or something like this. And this is not the way I understand, saving my people for trauma or something.
Yes, it's bad.
It's a problem.
I know. It's a problem. In the U.S., we attack when the stuff happens. We all agree on that. Mm-hmm. Preventing is hard, but I have to say that doing this podcast allow me to show and actually learn that we do have mental health coaches, first specialized on firefighters and EMS and police and military all over the country. It shows this it's not enough to do the prevention. Where I work, we have something called peer support team. Yeah, there you go.
I hear you.
Better?
Yeah.
Perfect. So what I work is called something, the peer support team. It's a group of guys, girls too, anybody from any rank that are specialized on identify any mental health problems or issues that's going on to the firefighter or the paramedic, and they can guide them to the right help. Like I am not a psychologist, psychiatric, or mental coach, anything.
Yeah.
But I know enough to guide you to the right help. Hey, I know you're going through a problem. I don't want you to commit suicide. Hey, let's take you from here, and I aim you to the right person that can help you. So we do have that, and that's something that is a lot of the fire departments are trying to implement, the peer support team. So I'm big into that, obviously, but yes.
So therefore, we have our crisis intervention teams, which we can call when I recognize during my shift, or something happens with me or my coworker, or there is a crisis like in mental health or something. I can call them, and they come and they get us out of the shift, and then they try to teach us the way through therapy or something, and they help us for the next weeks. But they are not therapy; they are just the first step of getting into therapy.
Exactly.
And I think this is a really, really good thing. This is totally important. But what to do before the trauma happens?
Exactly.
And we do too less there. Then we have some education things where you can learn for 20 hours, 2 days or 3 days, how to get rid of stress. But normally the people go there just to sit on their time and just to got the certificate. And I think this is not the right offer. And during my bachelor thesis, I was writing about sexual harassment and how to prevent sexual harassment between co-workers on a ambulance station. And I think we have to do a lot there. So
it is true, because at least in the US, I don't know how Germany is, but firefighting is mainly guys. It's all dudes. It's a big sausage party.
Yes,
there
it is.
It's a few females that work in the fire service. The same in the EMS. EMS is, at least in the US, it's mainly guys. Yes, it's changing. Which is great.
So we have, at the moment, when I see my students in my class, we have a 50-50 range.
Oh,
now.
Okay.
So it's really changing, but the more it's changing, the more problems will be like seen, I think, because when there were a few females only, they were not talking about, but now we have a 50-50 thing. And that's why the females and so the guys as well, start talking about kind of like things like Me Too and something. And during my bachelor thesis, I found out that sexual harassment is a huge problem in Germany. It is. So I got data which figured that out. And we do not have mainly any prevention for this. But this is a real big thing in getting mental health issues. So it is one true. Big part when you have trouble with your coworkers. Does not depend if it's sexual harassment or other problems. Then you have a stress point. Then you got a bad emergency call. It's a stress point. Maybe you have some trouble in your family. It's a stress point. Then you're hungry. You're tired. You have shifts to do in the morning, in the evening. You have to switch the shifts. These are so many things and points and factors which can cause trauma or health problems. And we do not do enough at this to prevent them. So it's a real problem, I think.
It's true. And if you got kids and you have a pediatric call with a child dies, and then you got your own kids, and then you got your wife or your husband, I mean, we can go on and on the problems that we can get. And it's true. I agree with you 100%. We don't have enough help. And talking to people around the world is the same way. It is the same.
It's crazy because we know about that. So we know that this is a problem.
Yeah.
The politics know this, the companies know that, the co-workers know that, everybody knows it. But no one is doing anything. And this is something I cannot understand. And it's not only we both know this, so it's all over the world. Even the guys in Chicago said the same to me, that there is a problem with mental health and preventing mental health issues. And this is completely crazy how nobody cares about this topic. I cannot understand this. True. And as a one-man show, you cannot change a whole system.
Yeah, that's what I said. This podcast, the intention that I'm doing this, and I'm doing it for money. I do it because I love it. And if someone, at least somebody, can listen to this and change the mentality, and hey, you know what? Let me do something to change myself. I did my job. That's it. That's all I can do. I cannot control what happened outside the podcast, but I can control the content that I put in, so people can understand that about mental health is something important. It don't have to be just EMS or firefighter. It could be just a home talking to your family, to your partner, to whoever. It's not just, but what as I see it is for militaries. No, it's everybody get affected. Everybody has some type of PTSD from something. Don't have to go to war. Like when we work as a paramedics and firefighters, we go to literally war every 3 days, every 24 hours or 48. You know, it's like being deployed. The guys, the police, I give it to them. They at least in the US, they get so much crap. And I get it. But those guys also suffer from mental health. I mean, there's so many things that we can do, but we don't do it. It's like we don't give a shit. Like we know it exists, but we don't care. I think it's the money too. It doesn't make money.
A thing I like about my school most is that we as a teacher and as an instructor do not understand our role only as teachers. We understand our roles as well as social workers, because sometimes we have students who suffer from many, many little tiny problems in their home with their parents or something. And I think it's very important to get them stable and to teach them how to deal with these tiny problems so that they get stable enough for the job they have to do. And that's why we and my co-teachers and the whole school understands our role not only as teachers for like little social workers as well. And my school is one of the first schools in Germany who is trying to get a special social working person only for these things. So this is not a normal thing at the moment. I do not know any school who's doing this in Germany, and we are trying to get this at the moment. Yeah. And
that's excellent.
Maybe I think this is a very, very good thing. Or my school did something for us as teachers. They installed a mental health coaching program. So when I have a problem, it should not only has to be with working things, it can be private things as well. I can call this coaching program, can say, hey, I have a problem. What can I do now? Can you send me some help? We can do therapy there. We can do just coaching things there. They are for me as an employee for everyone who wants to get rid of some problems. And I think this is a very good idea. And this is the thing the German Red Cross do to us, to the school, because my school is half part of the German Red Cross, nearly half part. Very difficult. So I think this is a good thing, and we need this more and more and more and more. We need this all over the country, all over the world. We need this in other countries too. I think
that's interesting. Getting a social worker to help the students. I never heard that before, and I think that's an amazing idea. That's
it is.
It's a baby step, but it's helping, and hopefully, whoever listens to the podcast and have some power to move stuff and to change. Hey, that's a good. Actually, I might ask somebody where I work. Hey, what do you think about this stuff? Bring a social worker at least once a month to help out with the guys.
It's only to get the students that stable that they are prepared for the job. Best way we can do it, and I think agree. For this is a very good idea, and hopefully we will get it next few months. So
awesome! That's wonderful, and well, it's an hour, so. It's been an amazing interview, to be honest. I've been learning so much from you. Yeah, because I have so many things that I want to ask, and I think we should do another episode. Focus on like your thesis if you want, or anything else. Yes,
I'd like to.
I will. Yes, we will. And shout out. Awesome! I'll shout out to Ali if you listen to the podcast, bro. Can't wait to go with you to anywhere. And Cristin, I got 2 questions. 2 questions. Who you recommend? No, before that one. What advice would you give to a brand new person who wants to become a medic, and to a person who's about to retire from the EMS side?
Let me do the retire at first. If you want to retire, just think about what you can do with your experience you earned over the last years, because maybe you can do something different with it. Not as a paramedic, but maybe as a teacher, or maybe as a person in the ER, or maybe. So I think a paramedic is not only a paramedic on the ambulance car. A paramedic has so many different ways to work, and maybe it's not retiring from the whole system. Maybe it's just another view you need, and not to get out of the system. And I did this. So I worked 8 years as a paramedic, only a paramedic, and then I was exhausted by every shift and by every patient, and everything was stressful for me. And I learned, okay, I need a different view. And I started working as a teacher. And from the day on I started working as a teacher, I figured out, wow, now I have fun on my job too, again, because I have a different view now. And that's why, not thinking of, I want to retire and buy health system, maybe you have another place there. Maybe it's not being a paramedic, but you have another working thing to do there. And I think the experience is just to throw it through the rubbish is not a good idea. So try to figure out what you can do with these experiences you did last years.
That's true. Like, I work as a paramedic at SeaWorld on a theme park. I know somebody who works as a paramedic on a cruise ship for Royal Caribbean. Yeah,
maybe this is another point of view.
And it's a different point of view. I got people that works in the hyperbaric chamber as a paramedic. I seen people scuba diving, paramedics. You can work in an oil company, oil rig as a paramedic. You can work overseas.
Offshore or something,
offshore, or you can work in a helicopter. You can work in the rural areas. I mean, so many options as a paramedic, not just in the US to Germany, it's around the world. You have to find you have to find what you like. And what do you recommend to a brand new person? Like, oh, I want to be a paramedic. Yay. What do you recommend to that person before getting to the field?
Wow. This is a very tough question.
Just,
crazy.
Hungry for knowledge.
I never thought about this question. I think one of the best advice is, if you want to do it. Because most persons are not going to this job, as far as I know, because they doubt that they can do it. But if you want to do it, do it. Just give it a try. And when you have the feeling, oh, it's not the right thing for me, okay, then you can do other things. But if you're thinking about and you think, hey, this is a beautiful job and I like to do something for other people and I want to help other people and I want to be there not only for medical problems. We are social workers as well. So main part of our work is doing social work, not only medical things. And if you like to do this to other people, so do it. So yeah, I think my advice is if you want to, do it.
Good. That's good advice, actually.
Yeah.
Just do it. Just like the guy from the movie Transformers, Shia LaBeouf, just do it. You've seen the meme? The guy doing, do it. Just do it.
And I like to add my most favorite quote. Now I have to think of how to translate it into English. The most unstoppable persons are persons who believes in wonders. And I think this is a quote. I love this very much. This is my absolute favorite quote. And if you want to do it, you can do it and you can make wonders and you can go into this job and you, can help other people out and you can make them smile and solve problems and be there for other persons. And I think this is the best you can do.
That's true.
Yeah.
That's awesome. Thank you so much for that advice. And since hopefully we have some German listeners, can you say that quote in German? If you don't mind?
Sorry, can you tell again?
That's fine. Since we will have eventually some Germans listen to the podcast or watching this podcast, can you say that in German so they can actually get it too? That quote? Mm-hmm. How do you say in German?
I have to read it out. Sorry. In German it is: Nichts ist schwerer zu stoppen als ein Mensch, der an Wunder glauben möchte.
Dankeschön.
So, yeah. This is it in Germany.
Awesome.
I was very happy to do this with you. Make so much fun, and I will be glad to do this again in another episode, maybe.
Yes.
Or if some of the audience have some questions to me, just ask, and we can do another episode with it.
Yes.
So, I'm into everything.
Awesome. So talking about it. So if somebody have a question, could be from the US, could be from Germany, anywhere in the world, where they can find you? Do you have an Instagram page that can see you? Hey, if you got questions about the German process or system or any paramedic questions, where people can find you?
They can find me on my personal Instagram page. It's called Scherfchen. Maybe it's a little bit difficult for English-speaking people because it's my last name with a chen, so C-H-E-N on the end. So Scherf, S-C-H-E-R-F. C-H-E-N. So a little bit difficult, but I think you will find me.
I will put on the description of the episode.
Yeah, this would be very nice, I think.
But at least the people can hear it. That's good.
Yeah. And I think you will notice it when you see a ginger-haired girl with paramedic things on the page. That's me. So.
Yes, that's you.
And you can ask all of your questions if you want. I'm very happy to get some informations and switch to other point of views and have other experiences from all over the world. I'm very into connecting to other people. So
that's what we're trying to do. And hopefully we can do an episode in Germany, person to person.
Mm-hmm. Oh yeah, this would be a good idea. Yeah,
that's my goal. If we can do it there, that would be awesome. If we can do it inside an ambulance.
Without lags of the internet.
Yes. But for now, that's what we have. Like I always say, you have to embrace the chaos and you have to roll with the punches. That's the only way you can do life. You have to roll with it.
I just want to say one last thing.
Yes,
hopefully my English was enough so I can figure out everything I wanted to talk about. Sometimes I noticed my grammar is not the right or the tenses are not very perfectly, but hopefully anyone understands me and
No, if they can understand me, they can obviously understand you.
Okay.
So you're good. Okay. We both had accents, just different regions of the world, but we both had accents. And before we leave, who do you recommend to be in the podcast and talk to and do this podcast with me? Who you recommend? Could be a professor, could be a colleague, student. Who do you think it will be perfect to talk to me on the podcast and talk about EMS?
A tough question as well. I'd like to be prepared for that questions.
I'm a tough interviewer. I'm not even a reporter.
I know over Instagram. I don't only know him in person, but I know him over Instagram. He's a physician on the helicopter.
Ooh.
Maybe I'm going to ask him if he'd like to join the podcast. He's a physician on, he's called Colmac and Leanne on the Instagram site. We stayed in contact over some years. Last 2 years, we do not have that much contact, but I can ask him if he wants to join. But he's working as a helicopter doctor, so maybe he's the guy.
Cool.
Yeah. I need to check. I need to check my contact list, so maybe I will have several other ideas. But
yes. Yes, of course. As long, look, if they can speak English, it's better. But if not, I guess we'll figure out. That's not a problem issue. That's not a problem at all. We can figure out stuff. I can put subtitles.
Maybe you can try a podcast in German.
Maybe I could try talking in German. It will take a little bit. It will be painful for you guys in Germany, but I will try. I know how to curse in German. That's all I know.
Yeah. We will figure that out.
We'll figure it out. Well, Cristin, thank you so much for being here. I have actually a lot of fun, and it was amazing, eye-opening experience from the EMS in German and how you guys do things, which is fun enough. It's similar to us. It's just like I said, language and culture things, but the
thank
basics.
you for having me.
Anytime you're welcome, more than welcome to be in the podcast anytime you want, even if I don't contact you, because whatever. Hey, Armando, I want to be in the podcast. I want to talk about something cool. Sweet. Let's schedule and do it. Because I'm all for communication, and I'm looking forward to do the podcast with you in Germany in person.
Yeah.
And
I think this will be the most greatest thing we can get through.
Yes.
Yeah.
And like I said, we can do like a project. I can show with Ali or whoever comes with me, or just me, how we do things in the US, and then maybe you can come over here and be in the Florida sun and Florida heat.
Yeah. Oh, yeah. I really like to go to Florida, so I already planned my vacation, and I want to go to Florida this year.
Perfect.
Yeah, I will do this.
So if you come here or go there, it doesn't matter, as long as we stay connected and we can do a podcast. That would be amazing.
So thank you for having me again. It was a pleasure.
Thank you so much. And guys, thank you for listening to the podcast, Bomberos on Fire. We are on Spotify, Apple, YouTube. Please subscribe. It will help the channel to get bigger and help the podcast to get more stuff. And thank you so much, and see you around. Peace.